Welcome, everyone. Today is Monday, March 9th, 2026.
Glad to be here.
And today we're stepping into a subject that usually stays behind closed doors or, whispered in doctors' offices or just buried in your email spam folder.
Yeah, definitely the spam folder.
Right. We are embarking on a really important exploration of erectile dysfunction medications. But we aren't just skimming the surface for this deep dive. We're looking way past the heavy marketing and those late-night television jokes.
And the massive societal stigma, too.
Exactly. We want to understand the actual literal mechanics of how these drugs interact with your body. So our source material for this deep dive into the source material is this incredibly detailed drug profile and patient discourse page. We pulled it directly from the iMedix medical content engine.
Version 3.13.37, to be precise.
Yes, that's the one.
And for those of you who might be analyzing this kind of medical data alongside us for the first time, iMedix, it operates as an independent medical information platform. It's this massive ecosystem featuring drug databases, clinical safety guidelines, and crucially, real, verified user reviews.
Which is so rare to find verified like that.
It really is. And the entire goal of platforms like iMedix, and the reason we do these deep dives focusing on patient safety discourse, is to elevate your education as a patient. The objective is to bridge that massive gap between complex pharmacological data, the kind you usually only see in dense medical journals, and you, the everyday person trying to make safe choices about your health.
Right, your cardiovascular and psychological health. So our mission today is to thoroughly demystify a generic ED medication called Silagra. We're going to look at the deep pharmacology, the safety profiles, and honestly, the very real human experiences behind the data.
The human element is huge here.
It is. We want to understand the systemic bodily mechanics, the strict rules of dosage, the dangerous interactions you absolutely must avoid, and the emotional weight of treating ED today. And to do that, I am joined by a resident master of connecting medical dots.
Well, thank you. It's a privilege to be here. This is a topic that is so widely discussed in pop culture, yet so frequently misunderstood. I mean, there's a vast difference between knowing a drug exists and actually understanding how it alters your cardiovascular system on a cellular level.
Yeah, totally. Okay, let's unpack this. I want to start with the foundational blueprint of this drug. The iMedix database introduces us to Silagra, manufactured by an Indian pharmaceutical company called Cipla Ltd.
Right, a very reputable giant in the generic space.
But when you look at the drug's classification, it's listed as a generic version of sildenafil citrate. And the thing that caught my eye immediately, the database lists its drug status as not approved.
Yeah, that one.
Right, because for a listener trying to navigate their health, seeing not approved sounds like a massive red flag. Like, what is the regulatory reality behind a tag like that?
I'm really glad you brought that up immediately, because that tag causes a tremendous amount of unnecessary panic.
I would panic.
Of course. But when you see not approved in a global database like iMedix, it's referring to the regulatory status in specific, usually Western, jurisdictions regarding that specific brand name. Silagra.
Oh, so it's about the name, not the drug.
Exactly. It is not a condemnation of the active ingredient itself.
Yeah.
Sildenafil citrate is one of the most well-understood, heavily studied compounds in modern medical history.
Yeah.
Silagra is just Cipla Ltd's proprietary generic formulation of it.
Okay.
Clinically speaking, it contains the exact same active pharmaceutical ingredient as the famously FDA-approved brand-name drug Viagra.
Got it.
So the not approved status simply means Cipla hasn't sought or been granted the regulatory green light to market that specific box with that specific name in certain countries. It's about complex patent laws, not safety.
Okay, that makes perfect sense. It's a legal distinction, not a biochemical one. So let's look at the biochemistry. The database classifies sildenafil citrate as a phosphodiesterase type 5 inhibitor, or a PDE5 inhibitor.
That's a mouthful.
Yeah, it really is. I understand we are talking about an enzyme blocker here, but what is the actual physiological process? Like, how does inhibiting this specific enzyme translate to sustained blood flow?
To really understand the mechanism, we have to look at the vascular environment of the body during sexual arousal. Yep. When arousal occurs, your nervous system releases a chemical called nitric oxide into the erectile tissue.
Nitric oxide. Okay.
Right. And this nitric oxide triggers the production of another chemical messenger called cGMP.
cGMP.
Now, cGMP is the actual hero of this story. Its sole job is to relax the smooth muscles lining the blood vessels in that specific area.
Oh, so it physically relaxes the tissue.
Exactly. When those smooth muscles relax, the blood vessels dilate. They widen significantly, allowing a massive influx of blood. That localized engorgement is what creates a physical erection.
So the body is creating its own natural vasodilators to flood the area with blood. Where does the PDE5 enzyme come into play?
Well, the body is a master of homeostasis. It doesn't want to leave those blood vessels dilated forever. So it produces the PDE5 enzyme. The purpose of PDE5 is to hunt down and destroy the cGMP.
It's the off switch.
It is the off switch. It breaks it down, which causes the smooth muscles to contract again, narrowing the blood vessels, restricting the blood flow, and ending the erection. Erectile dysfunction often occurs when this system is out of balance. The blood vessels just aren't remaining dilated long enough.
I see. So sildenafil citrate enters the bloodstream and essentially runs interference on the off switch.
It does more than run interference. It actively binds to the PDE5 enzyme and neutralizes it.
Wow.
Yeah, by inhibiting PDE5, the drug prevents the breakdown of cGMP. The smooth muscles are allowed to stay relaxed, the vessels remain widely dilated, and the robust blood flow is sustained. It's a highly targeted manipulation of your body's natural plumbing.
But there is a massive misconception that the source material addresses right away. And I think it's where a lot of the pop culture understanding completely misses the mark.
The aphrodisiac myth.
Yes. People hear about a drug that forces blood vessels to stay open and assume it's some synthetic aphrodisiac. But the database is incredibly firm. Silagra does not increase libido.
This is perhaps the most vital misconception we can clear up for you today. The cultural narrative tells us these are magic pills that instantly create psychological desire.
Right. Just swallow a tablet and boom.
Exactly. But the pharmacology dictates something entirely different. The medication absolutely requires sexual stimulation to work.
The database explicitly states under important precautions, wait, let me quote it, sexual arousal is necessary for the medication to produce an erection. If there's no arousal, the pill basically does nothing.
Right. If we go back to the biochemical cascade we just discussed, the drug only preserves the cGMP. It doesn't create it. The initial release of nitric oxide that kicks off the whole process only happens in response to sexual arousal.
Ah, so the brain still has to send the signal.
Exactly. The psychological and physical stimulation turns the system on. Sildenafil simply steps in to ensure that once the system is turned on, it stays on efficiently. It facilitates the physical response, but it absolutely cannot manufacture the psychological desire.
What's fascinating here is that because Silagra is purely a mechanical facilitator, it's only addressing the end result of the problem, just the impaired blood flow.
Right.
The iMedix text highlights that treating the symptom of ED is not the same as curing the underlying cause. And the causes listed are incredibly varied: vascular disease, diabetes, neurological issues, or psychological factors.
And that distinction is the cornerstone of patient safety. Let's say a patient has underlying atherosclerosis. That's the hardening and narrowing of the arteries.
Which is incredibly dangerous.
Highly dangerous. That systemic vascular disease might first present clinically as erectile dysfunction because the blood vessels in the penis are very small. They're often the first to show signs of blockage.
Makes sense.
So sildenafil might help that patient achieve an erection by chemically forcing those compromised vessels to dilate. But it isn't doing a single thing to clear the arterial plaque or cure the cardiovascular disease.
It provides a temporary bridge over the problem, but the foundation of the bridge is still crumbling.
Which is why the iMedix platform constantly emphasizes that a proper medical diagnosis is non-negotiable. You cannot just mask the symptom of impaired blood flow without investigating why the flow is impaired in the first place. Conditions like diabetes, which damages blood vessels and nerves over time, you have to manage those.
Treating the ED in isolation while ignoring the potential diabetes is incredibly dangerous.
It's reckless.
Okay, I want to transition into how a physician actually implements this drug, because managing that temporary bridge requires a calculated approach to dosing. The database outlines the available tablet strengths: 25 milligrams, 50 milligrams, and 100 milligrams.
Right.
I imagine navigating those numbers requires more thought than just, picking the middle option and hoping for the best.
Dosing strategy is everything when dealing with a systemic vasodilator. You might assume that a higher milligram count automatically equals better results.
More is better, right?
That's the human instinct. But pharmacology is about finding the minimum effective dose to avoid unnecessary toxicity. The iMedix guidelines provide a very clear hierarchy. The 50 milligram tablet is the standard starting dose for the vast majority of patients.
So that's the baseline.
It provides a baseline for a healthcare provider to assess both the drug's efficacy and how well the patient's body actually tolerates it.
Let's examine the outliers then.
Right.
Who is the 25 milligram dose specifically designed for? because the text highlights several vulnerable populations.
The 25 milligram dose is critical for patients whose bodies handle the drug differently. For instance, the guidelines single out elderly patients, specifically those 65 and older.
Because of metabolism.
Yes. As we age, our metabolic rate slows down, and our cardiovascular system can become much more sensitive to sudden changes in blood pressure. Starting an older patient on a lower dose mitigates the risk of a severe hypotensive event, a sudden drop in blood pressure.
And the text also mandates the 25 milligram dose for patients with hepatic or renal impairment, liver and kidney issues.
Right, because the liver and kidneys are the body's filtration systems.
If they aren't working at 100%, the drug is going to stick around longer.
Exactly. The liver metabolizes the drug, and the kidneys excrete the metabolites. If a patient has impaired function in either organ, a standard 50 milligram dose might accumulate in their bloodstream. It effectively turns into a much higher dose simply because the body can't clear it out fast enough.
Starting at 25 milligrams prevents that toxic buildup.
Precisely. And 25 milligrams is also the mandatory starting point for patients taking certain interacting medications, which we will definitely explore in a minute.
On the other end of the dosing spectrum, we have the 100 milligram tablet. The iMedix text is very firm here. 100 milligrams is the absolute maximum recommended dose, and it is not a starting point.
Yes, Silagra 100 is a heavily searched term on their platform, but patients need to understand that titrating up to the maximum dose carries a significantly higher probability of adverse systemic reactions.
It's riskier.
Much riskier. The clinical pathway is strict. You only move to 100 milligrams if the lower doses have been proven safe and well tolerated by you, but remain insufficiently effective for your specific vascular impairment. You never jump straight to the max dose.
Once that highly personalized dosage is figured out, the next logistical hurdle is the timing. The administration notes say to take the tablet approximately 30 to 60 minutes before planned sexual activity, and that initiates a very specific window of effectiveness lasting roughly 4 to 5 hours.
That 4 to 5 hour window is the drug's duration of action. It's the time frame where the concentration of sildenafil in your blood is high enough to effectively inhibit the PDE5 enzyme.
The iMedix FAQ section actually highlights a very common user dilemma regarding this window. They compare sildenafil, which is Silagra, to tadalafil, commonly known as Cialis.
The comparison really underscores how pharmacokinetics dictate lifestyle choices. Sildenafil is fundamentally an as-needed medication designed for a specific, relatively narrow time frame. Its chemical structure dictates that it's cleared from the body fairly quickly.
Whereas Cialis is different.
Right, tadalafil has a different molecular structure. It binds to the enzyme and remains active in the blood plasma for much longer, providing a window of up to 36 hours.
Wow, 36 hours compared to 4 or 5.
Exactly. The choice between the two isn't about which is stronger, but rather how the patient prefers to manage their time. The shorter window of Silagra requires scheduling that some find frustrating, while others prefer that the drug clears their system rapidly.
But that 30 to 60-minute onset time isn't a guaranteed biological clock, especially when we introduce food. The database includes a highly specific warning about that. While you can take Silagra with or without a meal, taking it with a high-fat meal significantly delays its absorption. I like to call this the steak dinner effect.
A steak dinner effect.
Yeah.
I like that. The gastrointestinal mechanics behind this are actually fascinating. When you consume a heavy, high-fat meal, think of a large steak, buttered potatoes, deep-fried foods, your stomach recognizes the high lipid content.
Right.
To properly digest those fats, the stomach slows down its emptying rate. The pyloric sphincter, the valve that lets food pass into the small intestine where most drug absorption actually occurs, it tightens up. It wants to give the stomach acids more time to work.
So if you swallow a Silagra tablet right after that meal, the pill is essentially trapped in a digestive holding pattern.
It's just sitting in the stomach waiting for the fats to break down. Because sildenafil is highly lipophilic, meaning it dissolves very well in fats, it gets bound up in the contents of that heavy meal.
So it's not getting to your blood?
The result is that the drug's entry into the bloodstream is drastically delayed. That 30 to 60-minute window can easily stretch to 2 hours or more. And the peak plasma concentration, the maximum strength the drug reaches in your blood, can be significantly blunted.
Okay, if a patient is totally unaware of that digestive mechanism, they might take the pill, wait an hour, assume the dose was too low because nothing is happening, and then make a very dangerous decision.
Taking another pill.
Exactly. Which brings us to the absolute rule in the dosage section. Never take more than 1 dose in a 24-hour period.
That is a non-negotiable pharmacological boundary. If the drug is delayed because of a high-fat meal, or if the initial dose simply wasn't effective, taking a second pill within that 24-hour window introduces a massive dangerous spike in the drug's concentration once it all finally absorbs.
You're doubling the vasodilation.
You are stacking the systemic vasodilating effects, which puts immense, potentially critical stress on the cardiovascular system.
Let's focus heavily on that systemic stress for a minute, because the body's reaction to this drug goes way beyond its intended target. We've established that Silagra is a vasodilator. It relaxes smooth muscles and widens blood vessels. But when you swallow a pill, it enters the systemic circulation. It travels everywhere.
Right, the drug is not equipped with a GPS tracker. It cannot exclusively target the vascular tissue of the penis. While it has a high affinity for the PDE5 enzymes concentrated there, that vasodilation cascades throughout your entire body.
If we examine the list of common side effects in the source material, we can trace every single one back to this core mechanism of widened blood vessels.
Let's trace them. The database lists headaches, facial flushing, nasal congestion, and dyspepsia.
Let's start with the headaches.
The headache is a textbook response to cranial vasodilation. When the blood vessels in the brain and the surrounding meninges expand, they press against sensitive nerves, triggering a throbbing headache.
And facial flushing?
That redness and warmth people experience on their face and chest occurs because the superficial blood vessels just under the skin are dilating. They're allowing a higher volume of warm blood to pool near the surface.
Okay, what about the nasal congestion? People usually think of a stuffy nose as a symptom of a cold, an excess of mucus.
In this context, it has nothing to do with mucus. The nasal passages are lined with a dense network of tiny blood vessels. When sildenafil forces those vessels to dilate, they physically swell. They take up more volume inside the nasal cavity, restricting the airway and creating the exact sensation of a stuffy nose.
That's wild. And the dyspepsia, or indigestion, is also interesting. How does a blood pressure medication upset your stomach?
Because the smooth muscle relaxation isn't limited to the cardiovascular system, the gastrointestinal tract is entirely lined with smooth muscle, including the lower esophageal sphincter, which acts as a gatekeeping stomach acid from washing back up into the esophagus. Sildenafil can inadvertently relax that sphincter, leading to acid reflux and the sensation of indigestion.
It is remarkable how interconnected the body's systems are. You take a pill to manage one specific vascular function, and your nose gets stuffy because the cellular mechanics are identical.
Exactly.
The database notes that these common side effects are usually mild and fade as the drug clears the system. It also offers a very pragmatic piece of advice. Staying hydrated can help alleviate the headaches.
Widening the blood vessels systemically causes a mild overall drop in blood pressure. Ensuring you have adequate fluid volume in your system by staying hydrated helps maintain that blood pressure. It can significantly mitigate the cranial throbbing associated with those vascular changes.
Here's where it gets really interesting. When I was reading through the iMedix page, I hit a section on sensory side effects that absolutely blew my mind. Under visual disturbances, it lists a mild, temporary blue tinge to the user's vision, or an increased sensitivity to light. A blue tinge to your vision.
It sounds like science fiction, doesn't it?
It does. I have to understand the mechanism here. How does a drug designed to alter blood flow in the lower body put a blue filter over your eyes?
It is a phenomenal quirk of pharmacology and enzyme specificity, or rather a slight lack of specificity. We know sildenafil is a PDE5 inhibitor, but small molecule drugs are rarely 100% perfectly targeted. As sildenafil circulates, it also encounters another enzyme called PDE6.
And PDE6 is located in the eye.
Specifically, it's heavily concentrated in the rod and cone cells of the retina. It plays a foundational role in the phototransduction cascade.
A what?
The complex chemical process by which our eyes capture light and convert it into electrical signals that our brain interprets as images and colors. Sildenafil is structurally similar enough to the enzyme's natural targets that it acts as a mild, temporary inhibitor of PDE6 as well.
So the drug crosses into the retinal tissue, mildly inhibits the PDE6 enzyme, and throws your color processing machinery slightly out of balance?
It alters the visual cascade just enough to cause synopsia, which is the medical term for seeing the world with a blue or blue-green tint. It can also cause a generalized hypersensitivity to light.
That is bizarre.
For the vast majority of patients, it's a bizarre but harmless and temporary side effect. But the database issues a very specific, stern warning for a certain demographic: patients with retinitis pigmentosa.
The text says they need to use Silagra with extreme caution due to theoretical risks. What is retinitis pigmentosa?
It is a group of rare genetic disorders characterized by the progressive breakdown and loss of cells in the retina. Because sildenafil is known to actively interact with the PDE6 enzyme in the retina, there is a theoretical but significant risk that inhibiting this enzyme could be actively harmful to a patient whose retinal cells are already genetically compromised and degenerating.
It's a prime example of why a seemingly localized drug requires a comprehensive analysis of a patient's entire genetic and medical history.
Absolutely.
Moving from the quirky to the critical, the iMedix database features a section titled Serious, Seek Immediate Help. These are the definitive red flags, the rare but catastrophic medical emergencies where you must immediately discontinue the drug and rush to an emergency room.
We really must emphasize the severity of these warnings. The systemic effects of this drug can occasionally trigger profound neurological and vascular emergencies.
The database lists a sudden decrease or complete loss of hearing. It also lists a condition characterized by sudden loss of vision in one or both eyes, medically known as NAION.
Yes, NAION is fundamentally a stroke of the eye. It occurs when the blood flow to the optic nerve is suddenly and drastically reduced, depriving the nerve of oxygen and causing permanent damage.
Is it definitively caused by the drug?
The exact causal link between PDE5 inhibitors and NAION is still debated in the broader medical community. But the temporal association is strong enough that the warning is completely mandatory. And of course, the text mandates immediate emergency care for any signs of a heart attack. Chest pain radiating to the jaw or arm, acute nausea, sweating.
If any of those systemic emergencies occur, the protocol is immediate hospitalization. But there is another highly specific urological emergency listed that carries its own severe consequences. Priapism. The database defines this as a prolonged erection lasting more than 4 hours.
Priapism is a terrifying medical emergency. While the entire goal of Silagra is to facilitate and maintain an erection, the mechanism must eventually turn off. In cases of priapism, the vascular off switch entirely fails. The blood becomes physically trapped in the corpus cavernosum of the penis. It becomes a closed, stagnant system.
And blood is only useful when it is circulating.
Exactly. The oxygen in that trapped, stagnant blood is rapidly depleted by the surrounding tissues. Without fresh, oxygenated blood circulating in, hypoxia sets in. The environment becomes highly acidic, and the smooth muscle tissues begin to suffocate and die.
That sounds horrific.
It is. The database warns that without immediate medical intervention, which often involves the emergency room physically draining the trapped blood or injecting counteracting medications like epinephrine directly into the tissue to force the vessels to constrict, the patient will suffer permanent tissue necrosis,
Which tragically results in permanent, untreatable erectile dysfunction.
The irony is devastating. The text also specifically notes that men with certain hematological conditions, like sickle cell anemia, multiple myeloma, or leukemia, are at a significantly higher risk for developing priapism.
Why sickle cell anemia specifically?
In sickle cell anemia, the red blood cells can physically deform into a crescent shape under stress. These deformed cells can physically clump together and block the microscopic outflow veins. It turns a chemically delayed erection into a massive physical vascular blockage.
It is a sobering reminder of the profound physiological changes this drug induces, which transitions us perfectly into understanding the danger zones, the specific drug interactions, warnings, and absolute contraindications listed in the text material.
This is where patient education saves lives.
The iMedix database is meticulously detailed here, and we need to unpack the specific drug classes they flag. Mixing Silagra with the wrong compound isn't just a minor error, it can be a fatal interaction. Let's start with the most prominent warning on the page, the absolute contraindication, nitrates.
An absolute contraindication in pharmacology means there is no gray area. There are no exceptions, no special circumstances, no maybe if we just lower the dose. Silagra must never, under any circumstances, be combined with nitrates.
What exactly are nitrates?
They are a class of medications primarily prescribed for the management of angina, which is severe chest pain caused by reduced blood flow to the heart muscle. Common prescription examples include nitroglycerin, isosorbide mononitrate, and isosorbide dinitrate.
And the warning also explicitly covers recreational drugs, right?
Yes, drugs known as poppers, which contain volatile alkyl nitrites like amyl nitrite or butyl nitrite.
I want to dig into the exact mechanics of this collision. Why is this specific combination so strictly prohibited? What is happening in the vascular system when sildenafil meets nitroglycerin?
We have to look at how both drugs independently manipulate the vascular system. Nitrates are incredibly potent vasodilators in their own right. They work by rapidly donating exogenous nitric oxide to the bloodstream. This triggers a massive, system-wide relaxation of the smooth muscles and wide-scale dilation of the blood vessels.
Okay, so the blood vessels are wide open.
Right. Now recall our earlier discussion about Silagra. Sildenafil inhibits the PDE5 enzyme, which is the body's natural mechanism for stopping that vasodilation.
I see. You have the nitrates forcefully kicking the blood vessels wide open and the sildenafil actively destroying the mechanism that is supposed to close them back up.
It creates an unchecked, catastrophic synergistic effect. When you combine the two, you get a massive, unmitigated dilation of the entire vascular system. The vascular volume suddenly expands so drastically that the blood pressure within those vessels absolutely plummets.
Like dangerously low.
It's known as profound, life-threatening hypotension. The blood pressure drops so low and so rapidly that the heart simply cannot generate enough force to pump blood to the brain and other vital organs. It frequently leads to syncope fainting and can easily progress to an ischemic stroke, a massive myocardial infarction, and death. Wow. The synergy is so dangerous that emergency rooms have strict protocols to ensure a patient hasn't taken a PDE5 inhibitor recently before administering life-saving nitroglycerin for a heart attack.
That is utterly terrifying, but it makes perfect physiological sense when you lay out the dual vasodilation. The danger isn't limited to nitrates, though. The database lists other blood pressure medications that require extreme caution.
Yes, the alpha blockers.
It specifically names alpha blockers like tamsulosin, doxazosin, and terazosin. They're frequently prescribed for benign prostatic hyperplasia or an enlarged prostate. It also lists general antihypertensives like beta blockers, ACE inhibitors, and calcium channel blockers.
Now, these are not absolute contraindications like nitrates, meaning they can sometimes be used together, but they require meticulous medical management and cautious dosing. Alpha blockers and other antihypertensives are explicitly designed to lower a patient's blood pressure.
Since sildenafil also independently lowers blood pressure as a systemic vasodilator, administering them concurrently leads to a highly predictable additive effect. I'm looking at the warning for alpha blockers alongside this drug, and both lower blood pressure. How does the body handle that dual command?
The body struggles to compensate for the stacked commands. The additive blood pressure lowering effect frequently results in symptomatic hypotension. The blood pressure drops just enough that you actively experience the symptoms of hypoperfusion.
Which means?
Dizziness, severe lightheadedness, or fainting, particularly upon standing up quickly from a seated or lying position. That's called orthostatic hypotension. Because this interaction is so common, especially in older men who might be treating both an enlarged prostate and ED, the iMedix guidelines specify a strict protocol.
What's the protocol?
If a patient is stable on an alpha blocker therapy and a physician decides sildenafil is appropriate, the patient must be initiated on the lowest possible dose, the 25 milligram tablet. They are then monitored closely to see how their unique cardiovascular system handles the additive drop.
This highlights exactly why a comprehensive medication review with a physician is mandatory. You cannot withhold the fact that you are taking prostate medication just to secure an ED prescription.
Never lie to your doctor about your meds.
Moving down the list of danger zones, we hit a fascinating chemical phenomenon that I want to spend significant time analyzing: the enzyme tug-of-war. The database brings up a highly specific metabolic pathway called the CYP3A4 enzyme system.
Oh, this is a brilliant mechanism to study.
And this concept is brilliantly illustrated by a verified user review on the iMedix platform from a user named Jonathan Mason. His review is essentially just a desperate warning. He says, yeah, definitely don't mix this with grapefruit juice.
Jonathan Mason's anecdotal warning points directly to one of the most critical functions of the human liver and intestinal tract. CYP3A4 is a specific isoform of the cytochrome P450 enzyme system.
Say that 3 times fast.
Right. Think of CYP3A4 as your body's primary chemical processing plant, or like a highly aggressive biological garbage disposal. Its primary evolutionary job is to identify, metabolize, and break down a massive variety of foreign substances, including the vast majority of prescription medications, so they can be safely excreted from the body. Sildenafil relies heavily on this specific enzyme to be cleared from the bloodstream.
The normal timeline is, you take the Silagra tablet, it enters the blood, it does its job on the PDE5 enzymes for 4 to 5 hours, and simultaneously the CYP3A4 enzymes in the liver are working to dismantle it and sweep it out.
That is the intended pharmacokinetic life cycle. But the complication arises because certain external substances act as potent CYP3A4 inhibitors. These substances physically bind to the CYP3A4 enzymes, occupying them or outright disabling them.
Effectively shutting down the biological garbage disposal.
Exactly. Grapefruit juice happens to contain naturally occurring organic compounds called furanocoumarins, and these furanocoumarins are incredibly aggressive CYP3A4 inhibitors.
So by drinking a seemingly healthy glass of grapefruit juice with breakfast, you are chemically paralyzing the exact enzyme required to process the Silagra you take later that evening.
Yes, and the consequences of that paralysis are severe. Because the CYP3A4 enzyme is blocked by the furanocoumarins, the sildenafil is not metabolized and broken down at its normal, predictable rate. It remains active in the systemic circulation for much longer.
It just builds up.
Its concentration in the blood plasma continues to rise. If a patient took a standard 50 milligram dose, but their liver is inhibited by grapefruit juice, the drug accumulates. The blood levels skyrocket, and the body reacts as if the patient took a massive, dangerous overdose.
This drastically amplifies the risk and severity of all the side effects we analyzed earlier. The crushing headaches, the severe hypotensive episodes, the visual disturbances, and the risk of priapism.
And grapefruit juice isn't the only culprit here. The iMedix database lists several common prescription drugs that act as equally potent CYP3A4 inhibitors.
It flags antifungals like ketoconazole and itraconazole, antiretrovirals used in HIV treatment, specifically ritonavir, and macrolide antibiotics like erythromycin and clarithromycin.
Ritonavir is actually one of the most powerful CYP3A4 inhibitors known to pharmacology. If a patient is managing HIV with ritonavir and also wishes to use sildenafil, the physiological clearance of the ED drug is so severely compromised that the clinical guidelines mandate a maximum dose of only 25 milligrams.
And crucially, they restrict the patient from taking that dose more than once every 48 hours rather than the standard 24 hours.
Your body simply cannot clear the drug normally when those inhibitors are present.
But the metabolic tug-of-war goes in the opposite direction as well. There are inhibitors that block the enzyme, and then there are substances the database classifies as inducers. CYP3A4 inducers seem to do the exact opposite.
Inducers put the CYP3A4 processing plant into absolute overdrive. They stimulate the liver to synthesize far more of the enzyme than normal, vastly increasing the body's capacity to metabolize foreign substances.
They make the garbage disposal spin 10 times faster.
Precisely the effect. The source text lists several powerful inducers. Rifampin, which is an antibiotic often used for tuberculosis, anti-seizure medications like carbamazepine and phenytoin, and notably St. John's wort,
which is a very widely available over-the-counter herbal supplement used for mood regulation.
These substances accelerate the metabolism of sildenafil so dramatically that the drug is dismantled and excreted before it ever has a chance to reach therapeutic concentrations in the blood.
I see. So if you take Silagra while regularly taking a supplement like St. John's wort, the drug is metabolized so rapidly that it might pass right through you and be rendered completely clinically ineffective.
You would assume the generic drug was a failure, or that your underlying vascular condition had drastically worsened, when in reality your own hyperstimulated liver was just destroying the medication too efficiently.
This entire CYP3A4 interaction profile is a masterclass in why pharmacology cannot be viewed in isolation. You have to analyze the entire chemical ecosystem of your body. Even a morning glass of juice or a seemingly benign herbal tea can fundamentally alter the pharmacokinetics of a powerful prescription drug.
It really emphasizes why natural doesn't always mean safe to mix with prescriptions.
That is wild. And it brings us to one final major interaction warning in this section that we need to dissect: the alcohol trap. The iMedix database unequivocally labels the combination of Silagra and alcohol as unsafe. I want to understand the dual mechanics at play here.
It is a double-edged sword of physiological failure, combining both cardiovascular risk and profound clinical irony. First, we must look at alcohol's effect on the vascular system. Alcohol is, in itself, a systemic vasodilator.
Okay, so it lowers blood pressure too.
Yes. Like the alpha blockers we discussed, significant alcohol consumption causes the blood vessels to relax and lowers overall blood pressure. Mixing it with sildenafil amplifies the additive hypotensive effects. You experience exacerbated dizziness, severe flushing, and a significantly heightened risk of orthostatic hypotension and syncope. You are placing completely unnecessary stress on the cardiovascular system.
That covers the cardiovascular risk. What is the clinical irony of the combination?
The irony lies in the central nervous system. The patient is utilizing sildenafil to facilitate an erection. But alcohol is a potent central nervous system depressant. Excessive alcohol consumption is clinically well documented to cause or significantly exacerbate erectile dysfunction.
Because it blunts the signals.
It blunts the neurological signals traveling from the brain to the vascular system, the exact signals required to initiate the nitric oxide release we discussed at the very beginning. So by drinking heavily while taking the medication, you are actively chemically counteracting the exact physiological response you are trying to achieve.
While simultaneously spiking your risk of passing out from dangerously low blood pressure, it entirely defeats the purpose of taking the pill in the first place.
Exactly.
If we connect this to the bigger picture, we have to remember that behind all of this intense pharmacology, behind the CYP3A4 enzyme pathways, the systemic vasodilation, and the contraindications, there are real human beings. They are trying to navigate a deeply vulnerable, often devastating aspect of their lives.
The patient narratives are incredibly moving.
The iMedix platform isn't just a sterile repository of chemical data. It actively hosts patient discourse and real-world reviews. Reading through these qualitative accounts reveals so much about the psychological and emotional weight of erectile dysfunction.
The clinical data tells us what the molecule does to the cellular receptors, but the patient narratives tell us what the condition does to the human mind. The platform's inclusion of these verified experiences is vital for a comprehensive medical understanding, because it reminds us why the pursuit of these treatments is so important to patients.
I want to look at a review that shatters the prevailing societal stigma regarding age and ED. There is an incredibly poignant, vulnerable review from a user named Solomon. He writes, "Being a 23-year-old with erectile dysfunction was a very embarrassing situation for me. I felt depressed all the time, and my self-confidence level dropped from 90% to 20% when I first noticed the erectile dysfunction. I made adequate research on a drug that could cure it, and I found the Silagra tablet. Would forever be grateful because I have experienced an enormous improvement in my sexual life."
Solomon's narrative is critical because society heavily conditions us to believe that erectile dysfunction is strictly a condition of advanced age, perhaps exclusively affecting men over 60 or 70. But here we have a 23-year-old man detailing a catastrophic, quantifiable drop in his self-worth, from 90% to 20%.
That is a devastating psychological burden for a young adult who is just beginning to navigate the complexities of intimate relationships. The isolation he felt must have been profound.
And it highlights the fact that physiological or psychological interruptions to the vascular system do not discriminate by age. Whether the root cause for Solomon was an undiagnosed physical anomaly or a cycle of severe performance anxiety, the emotional fallout was identical: intense depression and profound embarrassment.
I was deeply struck by the iMedix editorial team's response to his review. The platform administrator replied directly, "We understand that experiencing erectile dysfunction at a young age can be distressing and affect self-confidence. It's encouraging to hear that Silagra has made a significant improvement, and we're glad to know that you found a solution that works for you." It's validating. They aren't just policing the pharmacological facts, they are acknowledging his humanity.
That empathetic moderation is a crucial element of modern health platforms. It validates the psychological impact of the clinical condition. When a patient feels heard, their medical anxiety often decreases. And this emotional toll doesn't just affect the isolated individual, it radiates outward, severely impacting their interpersonal partnerships.
The relationship and mental health dynamics are incredibly complex, and we see this clearly in the review from a user named Katara Ang. The review states, "When I started experiencing erectile dysfunction, I got very scared. My partner was obviously not happy, and it wasn't a proud thing for me. This problem led me into extreme anxiety and depression. But then I came across this product, I started using it, and I'm happy to say that it shows amazing results."
Notice how quickly the words anxiety and depression surface in these accounts. But the added agonizing layer in this review is the partner's reaction. My partner was obviously not happy. The inability to perform physically creates a massive, immediate strain on the intimate bond,
And the patient internalizes that disappointment.
which fuels severe performance anxiety. And the surge of stress hormones from that anxiety chemically restricts blood vessels, making the physical symptoms of ED even worse. It is a vicious, self-feeding psychological and physiological loop. Intervening with a medication like Sildenafil can physically break that loop, forcing the vascular response to occur, which then allows the psychological healing and relationship repair to begin.
There is also a very brief but highly illuminating review from a user named Martin Robertson. He simply wrote, "This one helped me when I was on antidepressants."
That single sentence points to a classic, agonizing medical paradox. A patient seeks psychiatric help and takes antidepressants, often selective serotonin reuptake inhibitors, or SSRIs, to treat their debilitating depression or anxiety. However, a notoriously common adverse effect of SSRIs is profound sexual dysfunction, including severe erectile dysfunction.
So they have to choose between their mental health and their physical relationship.
This forces the patient into a terrible clinical dilemma. Do they continue treating their clinical depression but sacrifice their sexual function, which in turn might cause their depression to spiral again? Or do they abandon their psychiatric medication to regain physical function? Martin's review highlights that PDE5 inhibitors are frequently utilized as an adjunct therapy to manage this specific medication-induced side effect. It allows patients to maintain their critical mental health treatment protocols without entirely sacrificing their intimate lives.
It's a delicate, high-stakes balancing act of multiple medications. The final user review I want to analyze brings up a deeply frustrating clinical reality: the mystery of tolerance and shifting efficacy. User Ruth Huddleston wrote about her husband's experience. Silagra worked well for my hubby for a while, then it kind of stopped working. He took a break and then it worked again. Really weird. So if it stops, I suggest taking a break for 6 months plus, then try again.
Ruth's observation touches on a very real phenomenon in long-term pharmacological treatment. Patients frequently report that a previously highly effective medication seemingly loses its efficacy over time. They assume they have developed a chemical tolerance to the drug.
What have they?
While true pharmacological tolerance of PDE5 inhibitors is heavily debated, what is undeniable is that the patient's underlying physiology changes. Perhaps the husband's underlying vascular disease progressed over those months. Perhaps his natural testosterone levels declined. Perhaps his stress levels spiked. He took a 6-month break and upon restarting, found it effective again.
The iMedix administrator replied to her review with a very measured caution. They acknowledged that individual responses vary significantly over time, but stated, "It's important to consult with a healthcare professional for personalized advice and to discuss any concerns or questions about medication effectiveness."
And that is the absolute correct mandated medical stance. While Ruth's anecdotal experience with a 6-month cessation protocol seemed to work for her husband's specific physiology, the iMedix team rightly steers the broader community away from adopting self-prescribed timelines.
You shouldn't just guess at a solution.
If a critical medication stops working, a patient shouldn't arbitrarily stop taking it or just wait it out. They must ask their physician why it stopped working. Did a new medication they started interfere with the CYP3A4 pathway? Did their undiagnosed diabetes worsen? You must consult a medical professional to investigate the underlying systemic shift rather than relying purely on the anecdotal success of an internet comment.
Which brings us perfectly to the final major area of our analysis: looking at accessibility, the economics of the pharmaceutical industry, and the extreme dangers of the online Wild West when purchasing medications. We've established from the very beginning that Silagra is a generic formulation. But what does that classification actually mean for your wallet and treatment options? We have a user review from James Huang who wrote, "Compared to the big-name brand stuff, I'd say Silagra works just as well. But that's me."
James is observing the fundamental promise and economic reality of generic medications. Let's analyze the pharmaceutical life cycle. When a massive pharmaceutical company discovers and invents a novel drug like the original brand name Viagra, they pour billions of dollars into research and development. They fund years of rigorous clinical trials, safety testing, and massive global marketing campaigns.
To recoup those costs, they get a patent.
Right. Regulatory bodies grant them a patent. This gives the company the exclusive legal right to manufacture and sell the drug at a premium price point for a set number of years.
But eventually that patent expires, and the monopoly ends.
Exactly. Once the patent on the original brand name molecule expires, other pharmaceutical companies, like Cipla Ltd., are legally permitted to study the molecule and produce their own versions. Because Cipla did not have to spend billions on the initial risky R&D to discover Sildenafil, their overhead costs are a fraction of the original creators. They can manufacture and distribute the generic drug at a significantly reduced price, democratizing access to the treatment.
But the crucial question for the end consumer is it truly the same chemical experience? Does it work just as well as James Huang suggested, or is it a watered-down imitation?
Regulatory agencies require that generic manufacturers prove a concept called bioequivalence. The generic company cannot just throw the chemical in a pill and sell it. They must conduct rigorous pharmacokinetic studies to demonstrate that their generic pill delivers the exact same amount of the active ingredient sildenafil citrate into the patient's bloodstream at the same rate of absorption and reaching the same peak concentration as the original brand name drug.
So if it meets those standards, it's equivalent.
If it meets those strict statistical standards for bioequivalence, it is deemed therapeutically equivalent. The patient is receiving the exact same chemical mechanism of action for a fraction of the cost.
However, the combination of lower cost, high demand, and the intense stigma surrounding the condition creates a massive, highly dangerous secondary market. The iMedix FAQs note that Silagra Online is one of the most highly searched terms on the platform. And this is where the database issues some of its sternest, most dire warnings about the dangers of self-prescribing and bypassing the medical system.
Attempting to buy prescription medications from unverified online sources is genuinely playing Russian roulette with your systemic health. The database is unequivocal. Silagra is a strictly controlled prescription medication. It must be authorized by a licensed physician who has thoroughly evaluated your medical history. The internet is flooded with illicit, unregulated pharmacies selling counterfeit pharmaceutical products.
I imagine the risks of a counterfeit pill are astronomical. You might get a pill with zero active ingredient, or far worse, a pill laced with toxic industrial fillers or completely different, undeclared chemical compounds.
The risk of chemical toxicity is massive, but the danger of bypassing a physician goes even deeper. Avoiding a doctor means bypassing the mandatory cardiovascular assessment. We discussed earlier how the vasodilation impacts the heart, but we must also consider the physical act itself. The iMedix text explicitly warns that this medication is contraindicated, meaning completely forbidden for men for whom sexual activity itself is strictly ill-advised due to severe underlying cardiovascular instability.
The database lists highly specific cardiac conditions where this applies: unstable angina, severe heart failure, a recent stroke or myocardial infarction within the last 6 months, life-threatening arrhythmias, and completely uncontrolled high or low blood pressure.
If a patient has one of those severe cardiac conditions, their heart is already functioning on the absolute brink of failure. The sudden, intense physical exertion of sexual activity, combined with the mild systemic blood pressure drop induced by the sildenafil, could easily overwhelm the compromised heart muscle and trigger a fatal cardiac event.
The sildenafil does not protect your heart. It only facilitates the localized vascular engorgement.
A cardiologist must evaluate if your heart can safely handle the metabolic demands of the exertion. You absolutely cannot get that critical safety clearance from an anonymous illicit online storefront. Furthermore, the platform sternly warns that this drug is not for recreational use by individuals who do not actually suffer from clinically diagnosed ED.
Using it recreationally to enhance performance can lead to severe psychological dependence, where the user eventually cannot achieve an erection without the drug. And it exposes them to all the cardiovascular risks we've discussed for absolutely no medical benefit.
It's incredibly risky.
So the guidelines are clear. No self-prescribing, absolutely no recreational use, and no engaging with unregulated online markets. Who else is this medication explicitly not for? The demographic section of the database draws very hard lines. It is not indicated for women, it is strictly not for pregnant or breastfeeding individuals, and it is entirely unsafe and unapproved for children and adolescents under the age of 18.
Those demographic restrictions are absolute. However, there is one small, fascinating pharmacological caveat the database mentions for the sake of absolute clarity. There is a completely different formulation and dosing structure of sildenafil sold under the brand name Revatio.
Revatio.
That specific formulation is utilized to treat a severe, life-threatening lung condition called pulmonary arterial hypertension. Because it targets the vascular system of the lungs, Revatio can be used in different demographics, potentially including women and children, but only under incredibly strict specialized pulmonary care.
However, the database makes it crystal clear. Silagra tablets formulated for erectile dysfunction are not therapeutically interchangeable with Revatio for pulmonary hypertension.
The dosing algorithms are completely different. A patient must never attempt to swap them.
Finally, before we conclude, we need to touch on the practical, everyday handling of the physical medication. Storage protocols. How are you supposed to keep these highly specific chemical compounds stable and safe?
The chemical stability of the active ingredient is highly dependent on environmental factors. The storage guidelines dictate keeping the tablets strictly at controlled room temperature, specifically between 15 and 30 degrees Celsius, or roughly 59 to 86 degrees Fahrenheit. Furthermore, they must be kept in a dry environment, rigorously protected from direct light and ambient moisture.
I think about how most people store their prescriptions. The bathroom medicine cabinet, a room that gets incredibly hot, steamy, and humid every single time someone takes a shower. That's actually the absolute worst possible place to store a sensitive molecule like this.
It is the worst possible environment. Repeated exposure to drastic fluctuations in heat and high humidity can rapidly degrade the chemical integrity of the sildenafil molecule. The drug could lose its therapeutic efficacy, or the breakdown products could cause unexpected adverse reactions. It should remain sealed in its original blister packaging until the moment of use, stored in a consistently cool, dry place like a locked bedroom drawer or a high shelf in a hallway closet, completely out of the reach of children and household pets.
And regarding the practical reality of daily use, the database includes a very pragmatic warning about daily activities. You must use caution when driving a vehicle or operating heavy machinery. We know the drug can cause sudden dizziness from the additive blood pressure drops or visual disturbances like the blue tint and light sensitivity. You need to thoroughly understand how your unique physiology reacts to your specific dose before you get behind the wheel of a car.
And if a patient does experience those adverse effects or any unexpected systemic reactions, the iMedix platform heavily emphasizes the importance of pharmacovigilance. They strongly encourage patients to not only inform their prescribing physician immediately, but also to actively report those side effects to their National Pharmacovigilance Authority.
In the United States, for example, that would be the FDA's MedWatch program.
This ongoing post-market reporting from the public is how medical science continues to monitor the long-term safety and rare interaction profiles of drugs long after they hit the global market. Your individual experience actively contributes to the integrity of global medical safety data.
So, what does this all mean? We have journeyed through an incredibly dense, fascinating medical landscape today, guided entirely by the rigorous clinical data and vulnerable human narratives from the iMedix medical content engine. We've decoded the literal biochemical plumbing mechanics of how PDE5 inhibitors manipulate cGMP to relax smooth muscles and sustain localized vasodilation. We've navigated the complex pharmacokinetic web of the 4 to 5 hour window of opportunity, the disruptive lipid mechanics of the steak dinner effect, and the absolute life or death contraindications when sildenafil collides with nitrates.
There's a lot of pharmacology.
It is. We explored the intense metabolic tug-of-war involving CYP3A4 enzymes, furanocoumarins in grapefruit juice, and antiretrovirals, and we listened closely to the deeply human stories of young men and anxious partners attempting to reclaim their confidence and repair their relationships through proper medically supervised treatment.
If you take away anything from our deep dive today, it should be the profound protective power of understanding the why behind the medicine. Whether you are researching this complex pharmacological information for yourself, trying to support an intimate partner, or simply expanding your general medical literacy, understanding exactly why a drug carries a specific warning label is the ultimate tool for patient empowerment. You don't just passively know that you shouldn't mix Silagra with alpha blockers or alcohol. You now understand the compounding, additive, systemic vasodilation that makes that combination so physically dangerous.
Platforms like iMedix exist to bridge this exact informational gap. To translate the incredibly complex biochemistry of a Cipla LTD generic medication into actionable, safe, real-world applications for your daily life.
It is entirely about moving past the cultural stigma, abandoning the late-night jokes, and treating this condition and its chemical remedies with the rigorous scientific respect they demand. We've comprehensively covered the pharmacological facts, the strict clinical guidelines, and the vital user experiences. But before we end this deep dive into the source material, we like to leave you with a broader concept to consider.
Let's hear it.
This raises an important question. As global pharmaceutical companies continue to master the complex economics of generic manufacturing, producing highly effective, bioequivalent, and increasingly affordable versions of life-altering medications like Silagra, the barrier to access is dropping dramatically worldwide. It is cheaper and logistically easier than ever to find pharmacological solutions. But as it becomes so simple to seek out these treatments, particularly with the explosive rise of unverified online health searches, are we beginning to rely entirely too heavily on internet research to rapidly treat the symptoms of our failing bodies?
That's a great point.
By chemically chasing the immediate fix for impaired peripheral blood flow, are we accidentally ignoring the far more dangerous underlying whispers of our systemic cardiovascular disease, our failing metabolic health, or our deep psychological distress that are actually causing the problem in the first place?
A profound, sobering thought to end our analysis on. Treating the smoke doesn't extinguish the fire. Thank you so much for joining us on this deep dive into the source material. We hope you found that this exploration of the iMedix platform as clinically enlightening and deeply thought-provoking as we did. Stay curious, stay informed, and always consult your doctor. Take care, everyone.